How do you determine when you need spine surgery? A lot of it's based on your symptoms and your failure of other treatments that don't involve surgery. So if you've done all the appropriate non-operative care options for treating your condition, physical therapy, exercise, medications, avoiding those things that generally would provoke symptoms, then obviously if your condition warrants it, it can be considered for a surgical remedy. There are things that drive the need for surgery more rapidly, such as a neurologic deficit, changes in bowel or bladder function, weakness that develops in an extremity. Those are the kind of things where we would move more urgently for surgical care. So what's the recovery from spine surgery? How quickly can you get back to activities? It's variable based on what surgery you have to have done. We do a lot of surgeries that are minimally invasive at Scripps, involving small incisions. They're generally non-fusion surgeries. We also have minimally invasive fusion surgeries, but for most of our surgeries, they don't involve a fusion. Unpinching a pinched nerve, removing a herniated disc, taking care of a narrowing of the spinal canal via a procedure. Those are pretty quick recoveries. Most people are back to full activities within 6 to 12 weeks, generally overnight stays, even outpatient stays for some of these procedures. Our fusions take a little longer. They're a little bigger surgeries in some cases. Generally, the hospital stays are a little longer, 2 to 3 days, a little more limitation on activities early. And then for those patients, I tell them it's up to a year before they're completely healed, but 90% of the healing occurs in the first 3 months after surgery. What are the minimally invasive options for spine surgery? This trend of minimally invasive surgery is really, I think, what most of the surgeons at Scripps are doing now. So we're trying to make smaller incisions, less trauma from our surgical approaches, yet still achieving the same outcomes as traditional surgery in terms of getting nerves unpinched and spines to fuse where we need them to fuse. So there's a varying number of techniques actually that we will use to achieve that. So working through tubes, screw systems that allow us to place screws over wires under X-ray through very tiny incisions. There's all kinds of versions of minimally invasive, and we're doing them here. What are the risks of spine surgery? Obviously, you want to make the decision if you need to have surgery with some education and some understanding of what the risks are. Obviously, the spine is a foundational structure to hold your whole body up. It's also protecting the nerves. So unfortunately, one of the risks of doing spine surgery can be an injury to the nerves while you're doing the surgery, an injury to the structure of the spine as well. In a spine fusion, you can have a failure to heal that despite our best efforts, which would require another surgery potentially to fix that same thing. Risk of wound infections are now very low. We're all using very good techniques now, and our minimally invasive techniques, I think, have reduced our overall infection rate dramatically. Those are the common things we will see. Other things medically, blood clots, pneumonia after surgery, those are rare but can occur as well.